importance of social injustice in every healthcare interaction that affect clients, especially those with limited resources. We are going to be talking about social injustice in healthcare and how that affects different groups of people, especially those from the minority communities and those who have limited means of affording healthcare. Who will be taking the role of a client. My name is Benson.
And I'm Nurse Jenna.
And I am Nurse Practitioner Patrick.
Later.
Hi, I'm Nurse Jenna, and I'll be your nurse today. So what brings you in, Mr. Benson?
Yeah, last night I had a lot of problems, so I scheduled for this tele program so that I can get to see and get some help. I had a problem with my heart. I was feeling a lot of pain. I was nauseating. I was vomiting. I was feeling a lot of dizziness when I stand up to walk around. And I was also having difficulty breathing. So I felt like it was important to schedule for this meeting.
Oh, good. Okay, I'll take a look at your records and I'll speak with the nurse practitioner and I'll get back to you. Is that okay with you?
That's fine. Thank you.
All right, thank you.
5 minutes later.
Hi, Mr. Patrick.
Hey, Nurse Jenna, how are you doing today?
Oh, good.
Good.
We have a patient, Mr. Benson. He's 61 and he complains of headache, fatigue, sweating, chest pain, and shortness of breath. He also had an episode of nausea and vomiting last night. Mr. Benson has a history of diabetes, hypertension, and obesity. He admits to smoking a pack of cigarettes a day. His vital signs are blood pressure 154/84, pulse 75, temperature 37, and SpO2 at 94. His respiration is 22. Mr. Benson's case requires hospitalization and monitoring at the Mayonnaise Hospital. However, I have gone through his records and checked his health insurance. He has the Green Shield insurance coverage, but his insurance will not be able to cover the costs for the necessary hospitalization, treatment, and medication. He just can't afford it. So I was thinking maybe we should make provisions and send his blood pressure medication to the pharmacy and send him off to go pick it and make it a day, right?
Well, in our position as healthcare providers, we always have to remember that we are patient advocates. So now we must find an alternative for Mr. Benson. And so what I suggest is we are going to utilize our interprofessional team, specifically the social worker, so then they can be able to find a nearby facility that will accommodate Mr. Benson's insurance. Okay? So right now I'm going to work on talking to the social worker so she can better assist Mr. Benson and see what we can do to produce the desired outcome. All right, Ms. Jenny?
I think you're right. He has to be admitted immediately. Let me contact Mayonnaise Clinic and give his report to them. Then I will contact the patient and make sure he's transported to the hospital immediately.
All right, thank you.
Okay.
A little longer than a few minutes later.
Hi, Mr. Benson.
Hi.
It seems your situation needs more attention. So, we've arranged for your admission to Mayonnaise Clinic at 2132 Washington Avenue, which is about 4 miles from your house. Okay? Do you have any family member who can give you a drive to the hospital, or should we make arrangements to pick you and take you to the hospital right away?
Yeah, I will talk to my daughter. I think she's available. She's going to be dropping me at Mayonnaise Hospital. I've been there before. I think about 20 minutes we're going to try to be there.
Okay. Thank you so much.
Thank you.
All right.
What we're referring here is a situation where the healthcare system is fraught with social injustices towards persons of minority and poor and persons who cannot afford healthcare, especially the immigrants. You have a situation where somebody comes into the hospital with very limited means to take care of himself. He is fearful, confused, worried, and sometimes unconscious. And when they appear in the hospital, they need help. They need to be taken care of. And because of limited resources and lack of sometimes healthcare or good health insurance, the person is walked away, or the person is simply given prescription for over-the-counter medication and asked to leave. Such should not be the case. The nurse and the healthcare interdisciplinary team should be able to work something out to be able to take care of persons, especially those with acute cases. You have a situation where individuals, when they come with health insurances, and the health insurances cannot be able to help them see a specialist or help them afford a certain type of diagnostic investigations, health is curtailed and the person end up losing his or her life. One of the responsibility of the nurse is to advocate, is to make consultation with a social worker to find out whether there are alternative means to be able to take care of patients with very serious cases, so that they will be able to see the doctor or go through surgical procedures as needed. Very important.
In order to curtail the dilemma of social injustice within the healthcare system, nurses have to play their parts as patient advocates. Social justice principles, whether implicit or explicit, have been incorporated into nursing practice since its inception. Many of Florence Nightingale's writings address the need to consider the influence of social issues on health. Lillian Wald, viewed as the founder of modern public health nursing, established the Henry Street Settlement House in New York in the 1800s, where the poor could come and receive medical care and social services. Social justice is implemented in nursing when nurses practice the principles of social justice and leadership within the context of cultural diversity by ensuring that clients are always treated with dignity, ensuring supremacy of the common good while carrying out their duties as nurses, guaranteeing equal rights and responsibilities, ensuring fundamental options for the poor and vulnerable, and allowing opportunities for patient participation in the decision which govern their care. Social justice is implemented in nursing when nurses understand that the social environment of each patient is critical to the interventions required to cater for that patient. Social justice is implemented in nursing when nurses assume leadership positions in organizations that have structures and mechanisms where they come up with strategies aimed at promoting health equality. Social justice is implemented in nursing when nurses adhere to the code of ethics as laid down by Anna.
The definition of social justice revolves around the concept of equality and human rights. It aims to redress inequality based on gender, age, religion, race, and other characteristics. Social justice is the view that everyone deserves equal rights and opportunity. This includes right to good health. Yet today, there are inequalities in health that are avoidable, unnecessary, and unjust. There are several factors such as education, employment, socioeconomic status, and environment can affect an individual's access to healthcare. Nurses should be aware individuals and groups that have been historically marginalized and are currently vulnerable to inequality in healthcare. A client should not receive more or less care based on their socioeconomic status, ethnicity, race, religion, or sexual orientation.